This is the last video in this chapter, Care of Special Populations. Military veterans. This population is at increased risk for injury-related and stress-related health illnesses. They are at risk for mental health or behavioral adjustment disorder, substance use disorder with tobacco, alcohol, or other drugs. PTSD is extremely common among this population. Traumatic brain injury can occur as a result of external force injuries. Long-term health problems may result from exposure to chemicals and environmental irritants. Military veterans can experience issues leading to homelessness. Healthcare considerations when caring for this population include identifying and treating mental health disorders to assist in mitigating suicide risk. Treatment of comorbid conditions such as PTSD may help address substance use disorder. Use of screening tools in identifying substance use disorder is helpful. Treatment of PTSD includes exposure therapy, psychotherapy, and family or group therapy. Suicide among this population occurs on a daily basis. Veterans Affairs Services can assist in managing some of the health issues experienced by these individuals. Prisoners. The environment of a prison can predispose a person to different health conditions such as tuberculosis, HIV, sexually transmitted infections, or other infectious diseases. Rape is a concern among this population. Social determinants of poor health are often present in prisoners. They are at risk to have asthma, diabetes, hypertension, heart disease, and mental illness. Communicable diseases are also a concern for this population, such as HIV, hepatitis, and TB. Healthcare considerations for prisoners. The correctional facility is usually the sole provider of healthcare for this population. Screening protocols and procedures for individuals in this setting need to be consistent. Educational and vocational programs may help mitigate the health problems associated with living in a prison. History of incarceration increases risk of poor health due to limited opportunities to reform, inadequate housing, employment and education, and lack of family stability. Failure to address mental health issues among this population may contribute to repeated crimes when released from prison. Immigrants and refugees. Mental health problems are a primary issue for this population as a result of tortuous events. Additional challenges include learning to speak English, raising children, employment, housing, accessing health care, transportation, and overcoming cultural barriers. Risk factors. Acculturation to the U.S. culture increases risk for poor health. This includes eating a less healthy diet, increased smoking, drug and alcohol abuse, and lack of family support. Common health problems they may encounter include accidental injuries, hypothermia, burns, gastrointestinal illness, cardiovascular events, pregnancy complications, diabetes, poor nutrition, and hypertension. Other conditions that could result from the process of migration include tuberculosis, HIV, hepatitis, influenza, vector-borne disease, Middle Eastern respiratory syndrome, coronavirus, measles, mumps, rubella, polio, and antimicrobial resistance. Refugees are at increased risk for sexually transmitted infections such as HIV, lead poisoning, malaria, parasitic disease, and mental health issues due to war, violence, and rape occurring in camps. Health considerations include a process for offering services and treating immigrants and refugees should be available regardless of insurance status. This population may be eligible for short-term medical assistance in the U.S. but may lack health care coverage due to ineligibility for state medical assistance or inability to afford private health insurance. Vaccination should be provided to them. Breastfeeding should be encouraged to help prevent future health problems and to promote immunity. An individual with a communicable health condition should be treated before entering the new country of residence. Individuals with chronic illness. Individuals with chronic or multiple chronic illnesses are a health concern. Chronic illness is the leading cause of death and disability in the U.S. The prevalence increases with age, and it is a major cause of disability. Chronic illnesses include cardiovascular disease, cancer, respiratory disease, diabetes, mental disorders, vision and hearing impairment, oral diseases, bone and joint disorders, and genetic disorders. Often, more than one chronic illness exists at one time, and new chronic illnesses develop as a result of previous illness. Poor health outcomes and high health care costs are associated with chronic illness. Optimal care for individuals with multiple chronic illnesses may be limited because of multiple health needs present. Many health professionals do not feel adequately prepared to manage individuals with multiple chronic illnesses. Individuals with chronic illness are at risk for developing multiple chronic illnesses. Modifiable factors include an unhealthy diet, physical inactivity, and tobacco use. Non-modifiable factors include age and genetics. Other risk factors include globalization, urbanization, population aging, elevated blood pressure, blood glucose, blood lipids, and increased weight. When caring for these individuals, healthcare workers need to consider follow-up care to promote health. Focusing on a single illness does not effectively manage an individual with multiple chronic diseases. Rather, the big picture needs to be understood in management. Interprofessional collaboration is important in safely managing individuals with chronic diseases. Nurses play a key role in facilitating communication between providers and specialists. Inclusion of the client and support person or persons in healthcare decisions helps increase adherence to a complex healthcare regimen. Here are 3 sample questions in this chapter. Number 1, which teaching method is most effective when providing instruction to members of special populations? 1, teach back. 2, video instruction. 3, written materials. 4, verbal explanation. Answer to this question is number 1, teach back. Rationale is when providing education to members of special populations, return explanation and demonstration or teach back are of particular importance to ensure safety and mutual understanding. This method is the most reliable in confirming client understanding of the instructions. Video instruction, written materials, and verbal explanation are helpful and may be incorporated with the teach-back method. Sample question number 2. The nurse caring for a refugee considers which healthcare need a priority for this client? 1. Access to housing. 2. Access to clean water. 3. Access to transportation. 4. Access to mental health care services. The answer is number 4. Mental health problems are the primary issue for this population as a result of tortuous events. While all other options are important for all clients, they do not address the specific needs of this special population. Third sample question and the last. Which therapeutic communication technique is most helpful when working with transgender persons? 1. Using open-ended questions. 2. Using their first name to address them. 3. Using pronouns associated with birth sex. 4. Anticipating the client's needs and making suggestions. The answer is number 1. Using open-ended questions. The use of open-ended questions is most helpful in communicating with transgender persons because it assists in refraining from judgment and allows the client the opportunity to express their thoughts and feelings. The nurse should address the client with the name that the client prefers, so the first name may not necessarily be their preference. For the transgender person, it is likely that they would like to be addressed using pronouns associated with the sex they identify with now, which typically is not their birth sex. Anticipating the client's needs and making suggestions may be seen as passing judgment, so the nurse should refrain from doing this.